Today we have Melinda Huffman joining us. She's going to be talking about keeping your services legal, health coaching, this frontier, how to stay in your lane when we know many of our clinicians have very in-depth backgrounds and different practitioners. We vary on Sofia Health from MD, naturopathic MDs, to health coaches, life coaches, functional medicine practitioners, and more. Melinda is the co-founder of the National Society of Health Coaches, and she's a principal of Miller and Huffman Outcome Architects. She's a well-known health coach, educator, and best-selling author, writer, and renowned speaker on evidence-based health coaching, patient engagement, chronic condition management, and health outcomes. She's got over 30 years of experience in hospital and home care industries, so we could not be more excited to bring an expert in on health coaching and patient clinical outcomes. So Melinda, thank you so much for joining us. We're so happy to have you.
Oh, thank you so much for having me, Riley. It's such a pleasure to be with you and your group. I'm Melinda Huffman with the National Society of Health Coaches. And back in 2007, when we actually formed the society, we knew that health coaching was going to be something that was just going to explode. We just had that feeling from our clinician experience as the country moved toward wellness from illness and chronic conditions in terms of how we approach health and wellness. We believed that health coaching was going to take center stage ultimately. And in 2011, we really saw an explosion of interest, and not only interest, but clinicians and non-clinicians wanting more training, wanting to know what it was all about. And of course, with that, you get an explosion of programs and so forth. So we'll just go through some of this conversation today, and hopefully it will resonate with you. It certainly did with us as we got more into the legalities of health coaching. But because health coaching really has kind of exploded in the market, that has given us reason now, 8 or 9 years later, to not necessarily to pause. Research sometimes is also a laggard. And that's what we really found in health coaching and wellness coaching. There are some who would kind of fuse health and wellness. The society tends to separate those two, and it's because of the way we define health and define wellness. And we believe that those are two different dichotomies. While they will overlap in some areas, obviously, they can certainly be managed a little differently, each one, with wellness focusing on more of the person who is well and who wants to maintain health and maintain wellness. And then in health, it's more into the chronic condition management, the high risk or moderate risk individual, from familial risks on up to diet and exercise risks that will impact their condition in terms of chronic conditions. So that's why we look at that a little bit differently than others. In terms of explosion in the market with all of the various programs, you can Google health coach certification and you will find a plethora of programs. That was not the case about 10 years ago. There was us and another group who focused more on the wellness aspect. But programs have certainly morphed since then, and that's pretty much been because of the market that's driving that push and that need and that interest. So you've got different providers with different skill sets and different services. So therein lies what the most important thing about this is to be very clear about what you do. And that brings us to transparency. Nothing could be more important than transparency in terms of what your credentials are, who you are, what your services are, and the credentials for providing those services, as we mentioned. I always like to encourage people in terms of what they provide their clients or their patients, or both, is a little bit about their philosophy about health coaching, if that's what they're providing, wellness coaching, if that's what they're providing, or both, or even life coaching. And I'm not talking about a full paragraph. I'm talking about, a sentence or two. Because in your philosophy will also let your client know what my basic premise is, what my basic belief is, and how I'm going to approach our relationship. And I think that's a very important part of being transparent. Plus, it also helps them get to know you and to immediately begin to build trust. And if that's not something that they really, the direction they want to go, then you can save their time and yours by talking about that up front and clarifying. Or in some cases, and we hope rare, they decide that maybe this is not the best fit. And that's what we truly want is what's the best fit. So transparency, when we're now seeing this in some of our medical laws, meaning transparency in who you are credential wise. If you're an MD, say you're an MD. If you're a naturopathic physician, say you're a naturopathic physician. You know, it's very common in healthcare today to see providers with their name tags turned around. If they even have a name tag, they all look alike. We're all in scrubs. And many times I feel like that has been to the detriment of the formality of something as important as someone's health and their bodies and their mental capacity. When we're talking about transparency, I can't tell you how many times I've heard patients say, well, this person was in here, I don't know who they were, you know, they all look the same to me. So while that can be a little different when you're in your own individual practice, and I have my own practice as well, it's important that up front you tell someone the credentials that you have. If you have certificates of your degrees, of your certifications, if you're of your registrations, and you have an office where the public is going to be accessing your services, then I certainly suggest that you have these things framed and posted where they can see those very easily. It's not like you're, okay, look at me. It's like that's there for them to notice, to give them a degree of comfort, if you will, in exactly what they're getting. Not everyone needs an MD. Not everyone needs an RN. There's different types of coaching and different types of people who can provide that. But that's what I mean by transparent. Your credentials are not, and exactly what your services are.
On Sofia Health, we made that very clear. When you go to somebody's profile, you see their certifications, because we know as a consumer looking for the information, you want to get a whole picture concept of who they are. Even if an MD is online operating in a health coaching capacity, I want to know your background and all of your certificates, all of them. I want to know who you are and all of your education, even your degrees, non-degrees.
Absolutely.
So we made that first and foremost on the site.
And some states, I know Massachusetts most recently, but many states are now, and of course physicians are always going to be the ones who ultimately will have the final say in terms of approving anything at a state level regarding health. Does that mean they physically go through an approval process? No. However, if there's any question at all, be sure to know that your state's rules and regulations from that health licensing board will take precedent over anything. And some of these states are now beginning to recognize transparency and actually use the verbiage transparency and requiring transparency going forward because of this explosion of health coaching and wellness coaching and life coaching. And we know that it is a benefit. We've got some good outcomes from various groups that show that we're having some benefit because it's moving in the behavior change area, which medicine, nursing, dietitians, pharmacy, all of the credentialed healthcare providers have typically not taken that approach. It's been a do as I say do because we've been trained to be the experts. So now that we've moved into some behavioral health interventions, and it makes it for a wonderful relationship and much more than we could have ever done in the past. And I still say, we are, no question, still in transition. And that transition to this new way of engagement is going to be not only the future, but we're just beginning to touch the hem of the garment with that. So we've got a wonderful future to look forward to.
I could not agree more.
Let's look a little bit at nutrition. And we I call it the fly in the ointment, simply because it causes more of a struggle for most coaches than anything else. And there's a reason for that. We have two wonderful groups, who have slightly varying positions on this issue. And so, Melinda, what is the issue? Well, it's basically who can provide nutrition, under what conditions, with what tools, how, and by whom. So you have the American Academy of Nutrition and Dietetics. They will register dietitians, registered dietitian nutritionists, registered dietitian technicians. So they do the registration. Then we have the American Nutrition Association, and these are both wonderful groups. The American Nutrition Association will certify nutrition specialists. The State Practice Act where you practice your coaching or where you practice your nutrition or dietetics will guide how and who and when and so forth in relation to nutrition. So it's very, very critical that you be aware of what your state licensing board defines as nutrition and who can provide nutrition, under what conditions, with what tools, and so forth. That will keep you completely out of an issue, out of a legal issue. These two groups, where the American Nutrition Association wants to open that up, be a little more liberal in terms of who can provide nutrition, because we have such a nutrition problem in this country with obesity, and including the incidence and prevalence of childhood obesity, still a problem, and diabetes that still continues to be a major issue, a major condition for our country to deal with. But the academy would be more strict in terms of who can provide this information. So therein lies the situation in terms of the debate. But I encourage you to go to the ana.org/advocate site, but be sure that after that, what it does is it will give you a map of the states, and it will show you color-coded the different states and how they lean in terms of toward the ADA or toward the American Nutrition Association. But more importantly, in concert with that, I encourage you to go to your State Practice Act. It might be under your health licensing board. It may be under your health commission. Whatever state you're in, it will be under that type of department. And look and see what it actually says. This is what Tennessee's looks like, and this is what you can be looking for. Dietitian nutritionist, a licensed healthcare professional practicing dietetics and nutrition. Dietitian or nutritionist may be used interchangeably. That's the law as it stands in Tennessee. And then you would have necessity of licensure. It's unlawful for any person who is not licensed in the matter prescribed to represent themselves as a dietitian or nutritionist, or to hold themselves out to the public as being licensed by means of using a title on signs and so forth. So this is what this is going to look like when you go into your state to look for your own. This is very similar to the crux of what you'll be looking at, or what you'll need to find. So let's just think about the words terms do matter. We'll look at what is least likely to raise a red flag as you promote your services online, as you talk about your services to your potential clients or clients that you have or collaborative partners. We'll look at those that are least likely to raise a red flag, and then let's look at licensed language. So least likely to raise a red flag would be support, generalized, client-centered, client-guided, client-focused, healthy lifestyle, healthy eating. Licensed language moves into a different lane, and we'll talk about staying in our lane. Advice, prescription or prescriptive, counseling, assessing, diagnosing, treating, and even in some states, there's education. So it all depends on how your rules and regulations for your state describes this. But regarding nutrition in particular, when you use the term individualized meal plans or adapted recipes or adaptive recipes or nutrition counseling, that definitely moves into the licensed arena that you should avoid. And I think most, if you're not licensed, of course, and that goes for me. For example, as a cardiovascular clinical nurse specialist, I can certainly teach and guide people on a cardiovascular diet, but I would not be the one to assess the calorie count for that individual who may be wanting to lose weight. I can give them general ideas, but I would want to refer to a dietitian to go through an actual calorie count, nitrogen balance, adaptive recipes for that individual, because I don't have that degree of training or knowledge to do that for that client. So all of us need to stay in our lanes for the protection of the public. It's consumer awareness, public safety, and our own protection when it comes to legalities. Is there any question about those terms? We've got those that are least likely to raise a red flag, more safe, and then these that have a tendency to move into the regulated realm.
I think that this gets convoluted pretty quickly. Is that right?
It can, but if you're careful and follow your state rules and regulations, you're going to be safe. And
Great.
That's why I keep bringing up, go online, look at your state's rules and regs. And sometimes legalese can be a little difficult to understand, especially if you have not been in the clinical arena. So, but don't be afraid to contact those folks and ask any questions if you're not exactly sure what it's saying, because some states, and I'm glad you mentioned this, Riley, some states are very, very loose, and some states are very, very strict. So you've got the whole gamut, and you need to know exactly where you fall. So let's look at this just based on what we've mentioned, and let's see if we can pick out which one of these. And again, this, we're taking a sentence and we're talking about description of services. So let's do just a little test here, if you will, to see which ones you would choose. And we'll go to the next slide, which will have the answers. So let's read through these, and then you just determine either mentally or down on a scratch piece of paper, would this be licensed or non-licensed language? Let's go over and determine where you think this lies. We help clients identify their desired nutrition goals, because what you're basically doing is engaging them like you do in coaching to basically articulate what those are. And of course, through the use of motivational interviewing and other strategies, that occurs. And then we support their efforts in achieving them through behavior change strategies. So that would be non-licensed language. You can support, it's client-centered, client support, general, it's more general in nature. Number two, individualized meal plans is the key, as we mentioned, and I'm sure probably most of you remember that comment that we made about individualizing. And you'll notice that I purposely put the very first part of the number one and number two descriptions are exactly the same. We help clients identify their desired nutrition goals and their supports to achieve. It's exactly the same. But the key there is individualizing that meal plan. That is generally a licensed RD or nutritionist's realm of professional work that they do, that they are licensed to do or certified to do. Number three, we help clients identify their desired nutrition goals and advise accordingly. Again, that falls the advise, because think about it, a physician gives advice as to treatment planning. So that advise language is definitely very tricky and moves into the licensed area. Number four, we guide clients to identify nutrition goals and provide education to help them achieve those outcomes. Depends on your state's regulations. Most states would allow this as a descriptor for services for anyone wanting to provide, and we'll call it nutrition. I think nutrition is probably the biggest problem, because different states, like health coaching, will define it differently, nutrition that is. So you just got to go back to your state rule and reg. But it would depend on the regulations as to what the education component, who can provide that education, and with what tools. Some states would allow you to use more simple tools, and some would not.
I'm just going to ask a question on this. Why is it nutrition so regulated?
Excellent question. Right. And you could certainly do that in most cases. For instance, a diet that a physician has prescribed or that a prescriber has recommended for a patient. You can take that diet and you can help them understand that diet in terms of what they're to be eating, cooking methods, purchasing food, those kinds of things. But you've asked a very important question. And this has really come as a result of the Academy of Nutrition and Dietetics taking a stronger position and encouraging states to make a determination, because they felt like, from a consumer safety and awareness perspective, they felt like they were seeing people that were not getting the proper guidance depending on their health condition. So they made a push for the states to develop regulations that would curb just anyone going in and promoting themselves as nutritionists, because that's a licensed, regulated field. So, and there's a lot to do with licensure. It's very extensive. So it really came as a force of the Academy. And that's why I mentioned that you've got these two groups, with the American Nutrition Association taking a more liberal stance on it and trying to ease some of that restriction, if you will, because of the nature of our country's health. And I think we all can understand that. You know, there's a big need out there. And so the association was concerned that the need was not being met because the rule, you know, the Academy was getting so restrictive in its approach. But now when it comes to healthy eating, and taking a prescribed diet and helping someone understand that diet. Think about this. I mean, we've got 21% of our population as of 2020 that's functionally illiterate. And many people would not even recognize that or know that. But even the AMA, the American Medical Association, suggests that you put your materials at an 8th grade level. All the materials I develop, I prefer to put in a 4th grade level, just simply because of what we know and the history that we have in working with that particular piece of the pie. Let's look at number 5, I believe. We adapt recipes for clients' health conditions or needs. And the key word there is adapt. Adapting, depending on state regulations, may be very restrictive. When you're adapting a recipe, you're taking into consideration someone's health condition. We identify nutritional needs with respect to healthy eating and provide behavioral support for clients in making this change. Easy, non-licensed. Any questions or any comments? Yours have been excellent, Riley. I appreciate it. Your liability, and again, we don't want to we're such a litigious society, and that's not what I want to focus on the most. I want today to hopefully let you take away a few things that would make you think twice. You know, we all own our own businesses, most of us do. And so we want to be sure that we're doing this properly to stay out of trouble, because it costs money. When someone, wants to file a legal claim, it costs money. It takes a lot of time, and we don't want to go there. We want to be safe, smart, and move forward in providing the kinds of things that we love to provide and we know our patients and clients need. So respondeat superior is basically when you're working for an employer, that there is some liability that they share, and sometimes the full liability that they share for your actions when working with patients. And staying in your lane, we've talked about this a lot. It's important to make your role and your patient's role in your relationship very clear, and not to be hard-nosed about this, but when things go awry, and we see quite often that things can, it's important to have it laid out up front in simple language so that we're all adults here. So let's be very upfront. It certainly builds trust. And that's what this kind of relationship, a coaching relationship, absolutely has to have trust. And it only builds trust. And that's what we want. That's what we've got to have in order to help guide this client through to reach the outcomes that they want to achieve. So it's critical to be clear about what you are going to be doing in the relationship and what they're expected to do. Both have responsibilities to make this relationship work. We get a lot of questions about liability insurance, and we simply say use your own insurance company. Usually a home, life, auto will also have professional liability insurance. If it doesn't, you can just simply go online and find one that includes errors and omissions. That's the main thing there. HIPAA may be a law that some of you aren't even necessarily involved with. It's only if you are charging managed plans where you're getting paid by managed care, or where you are transmitting electronically diagnostic data or EHIs. That would be important for you to be aware of. These are the 10 most common HIPAA breaches, and that's as of May of 2019. And I've highlighted some of these. Snooping, we see that. Failure to encrypt, impermissible disclosure of the protected health information, and then improper disposal. Disclaimers can be used very effectively. It's not where I'm not going to be responsible and I'm pushing back and I don't like this, and so I'm just hear me, don't, I'm not responsible. That's not what we're talking about. We are talking about appropriate guarantees, representations, warranties that you have no control over. We want to softly say that we don't have control over that. For instance, and we use this in some of our materials, and I will have to say, I went online, just not scientifically random, okay? I just went online, randomly chose about 10 coaching websites of individuals who have a business, and not one site on any page did I see a disclaimer about anything. So I want you to think about doing that. Consider what a disclaimer might do for you in the end. And unfortunately, sometimes it's after the fact and wish we had some type of disclaimer. when something like this happens. But for example, our health coaching materials disclaim any particular result for the user. And that only makes sense. The information we provide will not make or break. It's going to be if the patient or client chooses to use that information, and then in what way. So there's a lot of nuances there that can create an outcome that we don't desire, but that is not going to cause injury, and is certainly not going to affect that negatively the situation. But it's always helpful to have that. So I call this a soft disclaimer. Here's another one. The health coaching encounter does not replace the guidance or prescription of a physician or licensed healthcare provider. And most of you will be quite familiar with this kind of language in both of these examples. Rather alarming, I suppose, is that you typically don't see them like you should. Keep that in mind. Give that some consideration for your website and your materials. I always find very small print to be very, it always makes me think, okay, what are they not saying just out for me to see? Are they hiding something? So I don't suggest this little fine print with an asterisk. You know, that's not what I like to go about do. I just want to say it like it is in language that both of us can understand. And it usually makes for just a much better relationship. It all goes back, the kinds of things I'm sharing today, all goes back to the relationship building and maintenance of that relationship. And just a bit about agreements and contracts. I do want to say this. A lot of times, especially if it's a friend kind of relationship, oh, but we've got this great relationship and I really don't feel, you will feel uncomfortable. I can tell you, especially if it's people you know, you will feel very uncomfortable with what I call a simple agreement or a contract, because contracts are typically this legalese. I don't like legalese because I even have trouble understanding it. And I have a master's in cardiovascular nursing, okay? So I don't like the legal language as a rule. I understand it when it comes to B2B. That's different. But B2C is totally different. You know, business to consumer is something that the consumer needs to understand. Almost a quarter are functionally illiterate. So you've got to kind of go over the head of your attorney and say, okay, write it where these people that are signing it can understand it. And we all know there's a big issue. We are conditioned because of what we see online. We'll click agree because we don't want to read 4 pages of very small print. So we've been conditioned to simply override, overlook, click agree, and move on. We're in a hurry. Let's get on with it. That's not the way to do a relationship when it comes to health. In a simple agreement, I like for the description of your services and your ethical standards, okay? What would you do in the event that a client begins to act inappropriately toward you? I've had some people say, well, I'll try to counsel them. No, if they're acting inappropriately toward you, then you're likely not going to be able to change that situation. You need to remove yourself from the relationship and explain why, okay? That doesn't become your role to counsel them about that behavior. Client and coach expectations, I briefly alluded to this earlier. Those disclaimers, any that you feel like are appropriate, and maybe you may think, well, I really don't have a disclaimer that's appropriate in my case. You'll be the one to decide that. It's just something for you to consider. Payment terms, nothing can get people riled more than their money, okay? Cancellation and refunds, that's also important too, to just, even if it's brief. I've seen these simple agreements not take more than 3/4 of a page. If it includes everything that applies, so be it. For me, the simpler the better. And of course, contracts are going to look much more involved. They're going to include those things, but you will, usually it's 3 or 4 pages. I don't recommend that for a coaching agreement because I think that can be a turnoff, but that is purely up to you and your region, your state. There may be some requirements as to how do you have to go about doing that. But the most important thing is that your client will understand what they're signing. The binding effect, usually a contract will have at the very end, this is a binding effect and it will be tried in the court of a certain state that where that business generates the contract. So that can be very scary. That'll run people away. So, but contracts, a true contract will typically have that binding effect statement. And just a note about third parties, I encourage you to take a look at your patient population. Those of you who are clinicians have been doing this for quite some time, but those of you who are non-clinicians may not have thought about this before. And that is, look at your population and then determine, and well, even clinicians too. I've seen clinicians not effectively make referrals when it's appropriate. Establish relationships ahead of time with referrals. Like, for instance, for me, I want to be sure that I've got a registered dietitian or a certified nutritionist nearby that I can call to say, would you be able to see this patient if I sent them over to you? Sure. Tell them to call me and we'll set up an appointment. Referrals are just good for a lot of reasons. First of all, we can't treat everything. There's not any one of us that can treat everything. And I use that word is usually, clinician language, but engage, we'll say. But when you establish relationships with someone outside of the realm of your capabilities, it makes for great working relationships. And you start collaborating business to business in some cases. And I found it to work exceptionally well. Find a psychologist or a psychiatrist in your area so that if you screen for depression or you feel like there is a mental health issue, then you can certainly, unless you are licensed to provide that type of engagement, then have that person ready to roll. I like having these referrals ready because it makes that patient feel like you have really been very proactive in getting things ready and seeing to their needs. I don't want to be referring to someone I don't know or just someone in general, or to refer back to the hospital and then find that's too many steps. Triggers. It's great to set up some triggers. In other words, I had designed a referral sheet several years ago that still comes in handy today. This is what physical therapy would like to see. This is what a dietitian would like to see. This is the kind of patient that mental health would like a referral for. And then you have those and you begin to commit those to memory, just like your assessment. Okay. Those are committed to memory so that you can, when you're engaging that patient, then you can tell them or talk to them, because some of them won't want to see. They will not want to go to see someone else. That's their prerogative. But you have that option if you see that need. And that referral source, by telling you what they want to see, that also lets you know the realm of licensure that may fall into. Or maybe a life coach is who they need. I want to establish relationships with a life coach as a clinician so that I can move that individual into that area if they so choose to desire. But for sure, we don't need to be like this little guy here, this prescriber who says, if you want a second opinion, there's plenty on the website. There's a million of them. Well, you could go online and find whatever you need. Well, we know that, you correct me if I'm wrong, Riley, but what we understand to be the case is that up to 80% of the medical information online can be incorrect.
So hard. It's amazing to hear all of this because we built so much of this into Sofia Health, and I'll touch on that in a second. Just for this, because we have so many Sofia Health practitioners on today, they've heard me talk about these Sofia circles and the importance of getting to know each other in this community. And we have a few hundred practitioners today, but why it's important for you guys to get to know each other, get to know the naturopath physicians, get to know the life coaches, because when your customer comes in, they need a care team. Individuals need, and when I say holistic, we need as an individual to be treated holistically. Our Facebook group is a great way to get to know each other because you cannot solve all of their problems. It's hard to build a relationship. It's hard to trust. We are a resource, but you are there to meet each other and bring in people into that circle of how you're going to treat them holistically. And one question I wanted to ask you goes back to this building this trust and relationship. It's hard for people to find you in the first place, the practitioners. And we've done all we can to help facilitate this relationship.
Which is great.
What else can we do to help? And what else can they do to help build that relationship?
What is great, and you mentioned something just a moment ago that I want to touch upon that also includes this, and that is clinicians. Remember, even clinicians need health coaches.
Oh, yes.
They don't have that behavioral health background. Remember, clinicians usually, unless they're in behavioral health, it's neck down. So they do not have that kind of expertise in behavioral engagement using motivational interviewing, positive psychology. That is something very, very new to them, even though those strategies have been around for 40 years and have tons of research to support it. They will not know about those things. And if they've heard it, they will not know how to use it. They are clueless in many, many cases. So when you step out, regardless of which side you're on, the clinician side or the non-licensed side, there's all kind of opportunity for building that relationship. Hey, I would like to be able, when I get patients that I feel like need more in the dietitian realm than I have to offer, I would like to be able to refer to you. Would you have an interest? Oh, let me tell you something. When you offer to give business to someone, they go crazy. They love that. And by the same token, you would love for someone to do that for you. So
Absolutely.
you've hit upon it. Instead of being afraid to maneuver into that area, when you start feeling comfortable in your skin with what you're able to do and what you should not do from a legal standpoint, it takes the pressure off. I mean, you begin to feel comfortable in reaching out to these potential referral sources, and even clinicians aren't sure about who to refer to.
No.
In some cases, they won't know
That is
all the dietary things.
absolutely.
Exactly.
That's a relationship in of itself. We're trying to help facilitate that many ways as we can.
Even
Personal.
Sofia Health, I don't think, and you can correct me if I'm wrong in the future, Riley, again, let me know. If you are more comfortable in your skin from a legal standpoint, then you are going to be much more comfortable in reaching out and being reached to increase your referral base. For me, it can only enhance my business, my practice. I have my own practice as well as the society. But only after going through a lot of the legal information and feeling more comfortable about where coaching is out there after being in it and teaching it for so many years now, well over a decade, it's made me feel more comfortable. And I feel like that it would make you more comfortable too.
Yeah, absolutely. But also having that growth mindset, it's a little bit hard. We'll just call it pre-Sofia Health. You have to call these clinics and you have to
Yes.
call the doctors and you have to call the front desk, and they're busy and they may not be receptive. But the cool part about what we've done is we've made it a little bit easier for you
Yes,
to
you
say,
have.
message you, in our Facebook group right now.
Absolutely.
We've made it easy for you guys to build these relationships with each other in a trusted environment, because it's so important to have a growth mindset and be open to talking to each other, not just in your own communities, because, and I want to clarify, so all of you that come from your own coaching communities, we know you get together, that's great, but you need to do cross-cultural get-togethers. You need to be the dietitians, the counselors, they need to be together, meeting each other. It's critical to do so to get the client and the individual the help they need. From a patient's perspective, an individual's perspective, they're only going to trust you more when they see you working holistically to get them taken care of.
Absolutely. Absolutely. I see it all the time. And many, I mean, 2 or 3 decades ago, we spent a lot of time on referrals and how that should work and how that could enhance business and what that can do for businesses. And it's amazing, but you have to be comfortable to do it. Not necessarily easy to reach out, but I have noticed now when you go on websites and you're doing searches for certain types of people, and let's just take physicians, they will have certain specialties beyond just being an orthopedic surgeon. These are the kinds of things I really like to do. I like to do knees, or I like to do shoulders. So they're also getting specific too.
Another thing I want to touch on is a disclaimer and the fees and the contract. First of all, we give you guys the ability to put your disclaimers, put your agreements, put your cancellation policy, put your refund. We've given you the ability to do that, but we've also given you the platform that is, we're getting people to have the expectations to see this.
It gives you a different level of professionalism.
Absolutely.
It enhances your business. There's no question.
Absolutely.
It enhances your business practice.
And as somebody who's created this platform for you all, you have a business online. You have to be as professional as you would as if you were in person. We've given you the ability to showcase your philosophy. People can meet you. It's transparent health and wellness now. Let's make it so standard that people are expecting it. That way it's normal and to not see it mean something.
Is that then other businesses can expect Sofia Health to have a level of expertise, professionalism, and that also it sends trust out the roof. I mean, it's a great thing to do. I mean, it's the only thing to do it right.
Absolutely.
So I encourage your coaches too to use that platform that you have to include these things. And like you say, that would be a standard of care.
Yeah, absolutely. When you look at this industry just all over the place across the country, I think we just really need some place to go to find transparency and have a way to say, I need help as a consumer and I don't even know where to begin. Now Absolutely. You get into so much social media marketing, and that's just not where people really need to be finding this information.
Exactly.
So be that professional practitioner on the site. Use what we've given you.
Absolutely.